We're thrilled today to welcome Dr. Danny Almirall to close out our season of educational seminars for the CTSA and the New York State Psychiatric Institute. Dr. Almirall is a statistician and effectiveness implementation methodologist who develops tools to form evidence-based adaptive interventions. Adaptive interventions are used to guide individualized intervention decision-making by clinicians for the ongoing management of chronic illnesses or disorders, such as drug abuse, depression, anxiety, autism, obesity, among others. Most recently, Dr. Almirall has been developing methods to inform adaptive implementation strategies and multi-level adaptive implementation interventions, MAISYs. These are multi-component implementation strategies that are used to guide ongoing decision makers by implementers, such as which strategy to offer to which organization, at what level of the organization, and when and based on which measures. He's the principal investigator of a NIDA P50 MAP Center, methodologies for adapting and personalizing prevention, treatment, and recovery services for substance use disorders and HIV. And he is an associate professor and co-director of data science for Dynamic Intervention Decision-Making Center at the University of Michigan. I'm so thrilled to have you here, Danny. Thank you so much for being with us, and I'll turn it over to you.
Anna, thank you guys so much for inviting me. I'm thrilled to be here, and I'm honored that you invited me. So here's what I'm hoping happens today. Here is the learning objectives. I want you to know what the 5 components of a MAISY are. So first, I need you to know what a MAISY is, and I need you to know what the 5 components. If all I ever do today is get through the first bullet, I've succeeded. So really the only requirement is bullet 1. Even if I stop talking after that slide, I'm happy to stop talking after that slide. And then there's 2 other things that could happen, that might happen, which is you might learn about a particular type of trial design that can be used to inform really good MAISYs. And there's many kinds of trial designs. I'm only going to talk about one of them. And then if we get really lucky and get to the very end of my talk, I would love for you to be able to describe the difference between an optimization trial and an evaluation trial. And those are my 3 learning objectives. And so my outline is like this. It's a 3-part talk. The first part is this warm up about, man, implementers have so many decisions to make. Their lives are so complicated. It's kind of like that. And then, and that's the part I wanted you to look over yourself. And then I'm going to talk about MAISYs. What are they? Why do we need them? And who are they for? And then I'm going to get to those randomized trials. Okay. So I do want you to sit back for a second and realize that the entire first 2/3 of this talk have nothing to do with research. This might sound shocking, but this is the way I like to do my talks. The first 2 parts of this talk is all about what is the implementation strategy that's going to live in the real world. It's only when I get to the 3rd bullet that I put on my scientist hat and I start asking questions, because that's what we do as scientists. We ask questions, okay? And then final thing, Rachel and Sapana encouraged me to ask you to jump in with questions whenever. Don't wait until the end. I prefer it if you interrupt me, because it's not really an interruption. It just makes it more fun. Okay, are you guys ready? Can I get a thumbs up? Here we go. All right. So this was that whole multiple decisions thing. And basically the bottom line is there's a lot of barriers and a lot of facilitators across many decisions. And implementers have a really hard job, which is, what strategy do I give to which site, at what level, and when? Okay, so that was all your homework assignment. All right. And here was the poll I was going to ask you to see if you did your homework assignment, and which is, hey, what's the major challenge, or a major challenge, facing implementers? And here I'm using schools as my example, but just replace it with clinics if you want. What's a major challenge facing implementers working in clinics, across different clinics within a health system, for example? It's difficulty recruiting and randomizing. B, deciding which strategy to provide. And C, the growth curve model doesn't converge. All right. So obviously the answer is B. Okay. All right. Let's get right to it. So second part of the talk, I wanted to propose MAISYs, this thing I'm calling MAISYs, multi-level adaptive implementation strategies, as one possible solution to the problem that I set up in the first third, which is, oh my, implementers have so many decisions to make. They have all these strategies, right? Because all these implementation scientists are creating the last time somebody compiled them, there were north of 100 different strategies. And which ones do I use? And if you think about a lot of those strategies, in the compilations, it's not yet clear whether they're like what level the strategies are for. So it could actually be 300 strategies if I have 3 different levels and if you have 3 different flavors of them. So really, implementers have a tough job. Is what I'm trying to get you to appreciate. Okay, so what's a MAISY? Here it is in words, and I promise to show you a picture. A MAISY is a sequence of decision rules that is used to guide how best to adapt the provision of strategies in 3 ways. At critical decision points, that's time. Across multiple levels, that's context. And then the third one is the how. And the how is we do it using baseline and ongoing changing status of all the little moving sites, if you will, targets inside any of my levels. Okay, so let me show you this cute little picture that we drew up. This is the first time I use a circle to describe anything adaptive, but I hope it works. So let's pretend we're starting here at the bottom right at time, and let's just pretend for a moment that time is time 0. So implementer just showed up at the doorstep of Kaiser Permanente. I don't know. I'm just making that up, right? Or implementer just showed up at the doorsteps of Columbia University's medical system. There they are. Implementers there. So that's time 0. Well, the first thing that implementer is probably going to do is take the status, take the temperature of what's going on. That's S for status at time 0. And then their goal is at time 0, here's the little implementer pushing the cog. The cog is an implementation strategy, one of the gazillions that we have. And what I want to do is I want to have these decision rules in place to help guide what they're doing. I want to help guide what this implementer is doing. And ideally, this little decision rule takes in whatever values of the status at time 0 and recommends an action so that the implementer can do it. Everybody with me? And then, of course, I do my strategy, whatever it may be, and I have some proximal outcomes in the short run. These are really cool. Proximal outcomes might be like implementation is on the right track all of a sudden because I did this thing, right? It could also be some mechanisms are being addressed, like, hey, all of a sudden, my clinicians have a little bit more cognitive behavioral therapy skills, right? Or whatever the case may be. And then, of course, there's long-term outcomes, which is like, hey, did we finally implement in the long run? Like a year later, is this evidence-based practice in place? And also in the distal outcomes over here, we also have our mental health outcomes, right? For our students, for our patients, right? And so on and so forth. Okay, so that starts at T and goes all the way out the door here. But the fun is, this is where the fun is when we move to the next decision point, T+1. Because like a month later or a week later, the implementer is still there. They're still doing their implementation and they're scratching their head saying, okay, I'm going to take some of what I learned here, some of what happened, and I'm going to update the status, ST. So now the implementer has a little bit more in their head. And now hopefully they have another decision rule that's guiding what they're going to do next. This is called a MAISY. It's M because at any one of those time points, I might be at the higher level. Say I might be at the director's office, or I might be, me, the implementer, I might be talking to one of the clinicians, or I might be talking to one of the staffs at the clinic, or I might be talking to the director of the clinic. Who knows, right? That's the M. It's adaptive because the circle keeps going round and round, and every time I intervene and every time I act, I learn something, and then I adapt the thing I do later based on what I learned. That's why it's multi-level adaptive. And then it's, of course, an implementation strategy. I've underlined along the left here some of the things that make this a little different from the way we typically think of implementation strategies. If it's not underlined, you've seen it before. If it is underlined, it's because it's new. MAISYs have decision levels. So what level am I making a decision at? Decision points, because everything is tracking across time. I don't have just one strategy. I have many options for my strategy. I have tailoring variables. These are the variables that I use to make the decision. And then, of course, I have the decision rule that's guiding the implementer in terms of their decision. Okay. This is an example that I am going to use throughout the talk. I'm going to use two examples. They both come from school settings, but just so you know, I'm not a school-based only researcher. Both do relate to mental health, which I hope you guys can appreciate. Since this is like a mental, well, okay. And so here we go. The state of Michigan, one of the great things happening at the state of Michigan and all the high schools is every high school has a school social worker or a school psychologist. I call them a school professional whose job is to deliver all mental health and substance use services at the school. So that's great. Go Michigan for having that in place. That's not what this implementation is about. The problem is that when we look to see what these folks, these school professionals are doing in high schools in Michigan, it turns out that it's not evidence-based. In fact, one of the statistics that I'm seeing lately, which is shocking, is that something like 3.5% of all interventions being provided in schools across the nation, 3.5 are evidence-based practices and being done to some level of fidelity. Holy cow. We have a long way to go in the United States of America, okay? And I'm just talking about schools. And actually, what's bananas there is that schools happen to be the place where the majority of mental health and substance use services are either begin or are offered for kids in America. So this is like shocking. Okay, so that's the setup for the problem. Now, what is the MAISY? What's the implementation strategy we dreamed up? Well, it's multi-level because in green, you're going to see I have district level components. And in purple, you're going to see I have school level components, okay? So imagine I go out to all the counties in Michigan. That's what my district is. A district is a county for today's purposes. And at the district level, at each county in the state of Michigan, I do something called REP. Now, let me tell you what REP is. I'm gonna fast forward through what it is. I can give a whole talk on it, but basically REP is multifaceted. It has a bunch of bells and whistles. The first thing is I bring all of the school professionals from all the high schools in that county. I bring them to like a Holiday Inn or some university or whatever, and we do a weekend training on CBT. Okay. And by the way, the whole purpose of this adaptive implementation is just to put cognitive behavioral treatment principles into the hands of these school professionals. Got it? So at the Holiday Inn, right here, when we kick things off at time 0, we bring all the school professionals and we do a 2-day training. It's over a weekend sometimes. You know what I mean? But a lot more happens than just training. I hand them over the manual, right? The CBT manual. And of course, it's not the manual. It's like 3 manuals because everybody does it modularly these days. And we're teaching them to do it group-based CBT, individual full session CBT, and we actually even have a individual 15-minute session CBT. So we kind of go through all that. And that's a lot. And then we do a bunch of other things. We give them a phone number and we say, hey, if you get stuck doing CBT, give us a call. That's sort of the technical assistance, right? Or what I call the pool intervention, the pool facilitation, because they have to call us, right? So that's not that expensive from the implementer's point of view, very burdensome from their point of view if they make the call. All right. All right. So that I still call that a low intensity strategy because they got to call me. They got to call the implementer. And then the other things we do is we enroll people into our website. When I say our website, this is not something at the University of Michigan. In fact, it's the website for the implementers. And the implementers, I could go on and on about who they are. They are basically an LLC here in town in Ann Arbor. So they're not, the people delivering these implementation strategies are not researchers. That's key. That's key. Okay. And then the final thing that's important about REP is that REP also includes a monitoring and engagement protocol. This is really important. It's like keeping people in the game. keeping these school professionals and these school leaders in the game. So it has like a newsletter where we talk about all things CBT and we give tips and blah, 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 right? That's like engagement, but it's also part of like getting them to come to the website, to learn more and to build on what they learned at the Holiday Inn, right? The website has all these pool resources. Are you guys following me? That's all happening in rep. And I think I got to stop talking about rep right now. And that's my low intensity intervention. All right. 12 weeks later, we know whether a school is a startup school or not, because essentially we know if they've tried it. Have they even tried to provide CBT? Okay. If they haven't tried, they are what I'm calling a scale-up school. They haven't done diddly squat. If they have tried, after basically 3 months, right? Giving them a chance for 3 months. Then if they're a startup school, we say, gee, this school needs coaching. Okay. So in this example, MAISY, we send off, and in this MAISY, believe it or not, this was in the full blown, like the coach drove out to the school. So now we're talking mega dollar signs. Like if you're the state of Michigan, like we literally had a human body drive out to the school all across, even in rural parts of Michigan. This is a pretty representative study. So urban, rural, we drove out there. And now you're doing coaching, and this is CBT skills coaching. So talk about mega bucks. The coach comes every day. They do their thing. They train them. They watch them. They give them feedback, the whole nine. It goes on for weeks. Okay. And then at week 21, so remember, at this point, all the schools are getting rep, and some of the schools are getting coaching. Everybody with me? All right. Regardless of whether you got coaching or not, at week 21, we then classify you as whether you're responding or not responding, because by then we think we have a good grasp on whether you're like responding to this stuff. Because this is week 21 after rep, after that Holiday Inn. So the way we define slow responding is we do it twofold. We say, hey, have you just not been delivering CBT? All right, we set a really low bar for what that means. Or even if you're delivering CBT out of the wazoo, are you having a lot of barriers to CBT delivery? So that's what we call a slow responding school. It's kind of like you're either actually slow responding or slow responding in the wishful sense. Like, man, they have their ducks in a row, but they seem to really have all these barriers. They don't want to be slow responding, but they are. And then there's, of course, slow responders that are just slow responders because, well, they're not delivering CBT. So for either one of those reasons, we then add facilitation. Now, this facilitation intervention is different from coaching because this one targets any of those barriers that were elicited, if any were elicited, right, provided. And it is designed to target what I call business level barriers, like you're not getting along with your school principal, so they're not giving you a room for you to do CBT or whatever. And it turns out that's an actual example in the state of Michigan, believe it or not. It's hard to believe, but that's true. So like the facilitation is more about giving these school professionals the tools to get what they need to do to get CBT done. You got it? So it's not CBT skills. Although I have to say, this facilitator is actually pretty good at CBT, and they can answer any questions that arise related to CBT. They're just not like a full-blown like card-carrying coach. Do you know what I'm saying? You guys got me? And then the other thing about this facilitation intervention or strategy is that it's telehealth. It's not in the flesh. It's a phone call. But unlike the phone number we gave them over here, facilitation is a push. So once we know you're a slow responding school, we go into go mode here. That is, we start calling you like twice a week, check in. You guys got it? All right, everybody understands. This is amazing because the school level strategies are being adapted as I go based on things I'm learning. Everybody got it? And it's amazing because it's multi-level. All right. If I stop right now and all that you understand is what a MAISY is, I've succeeded in my talk. So what are the 5 unique components of a MAISY? If you were paying attention, are they A, decision levels, decision points, strategies, options, tailoring variables, and decision rules? Are they B, the implementer, the decision levels, the targets, the decision points, and outcomes? Or are they C, the estimate, the estimator, the hypothesis test? Well, this is a trick question because if I was asking you what are the 5 unique components, it would be B. But in fact, A and B are all components of a MAISY. So it's a bit of a trick question. A and B are all components of a baby. The unique ones are B. They're the new ones. Because if you look at the A, you're like, Danny, Byron and Enola and all those people, every time they define implementation strategy, they talk about, they talk about B. A are the new ones. So I had it backwards. So you always hear them talking about this, B. They want all of us to be talking about it, but A is the new one. So we have these new little things because it's amazing. All right. All right. Let's rock on. Here's a second example. Also in schools, also mental health. I'll go much faster through this one. This is a colleague of mine called Elizabeth Connors. She's at Yale. She's a go-getter. She's great. She's doing amazing work on trying to get measurement-based care into the hands of clinicians working in schools in the state of Connecticut. Really cool stuff, except her 2 levels are districts and clinicians. So her implementation strategy, which is called Focus, it doesn't go to schools directly, even though its purpose is to improve what the people in schools are doing. The reason it doesn't go directly to schools is because all of the people working in schools in the state of Connecticut are all like county employed. You know, they're not like school level, like, you know what I mean? So she decided to go right after the clinicians. So she's basically got county-wide strategies and clinician-wide strategies. And all of these clinicians are housed at the county. Everybody with me? So interestingly enough, her implementation strategy is amazing, but it skips schools, even though that's where the clinicians are working. Are you guys following me? Kind of interesting if you think about it. And I'm going to go really fast through this one, but she's got these 2 stages where all she's doing, she's banging out these strategies at the county level. And she does it for like a good 4 months. So she shows up at the county seat. She calls all the clinicians to the county. They're employed by the county anyway. And she starts doing all these things like preparation there's a whole thing going on there. Training, she trains them up in MBC, group consultation. So training is kind of like coaching in my other example. That's kind of like what's going on here for Elizabeth. She's training them in MBC. And then group consultation is kind of like facilitation in the other example, except she has them all in groups at the county. And so she's banging out all these strategies during the first 4 months. Now, here's where it gets interesting. At month 4, remember, she's doing all this at the county level. She notices some clinicians are struggling. They're on the struggle train. Okay? You guys got it? Some of these clinicians at the county level, remember, they're working in schools. She knows this because they've barely done any MBC. You see my little cutoff down there? That's my little cutoff. So then she says, Danny, what I want to do is I want to give these under-implementing clinicians a little boost. And I don't want to do it in a group setting. I just want to go after them and give them individual consultation. So now she initiates these phone calls. That's what individual consultation is, with just this clinician who's struggling. You guys got it? So this is another MAISY because it's got districts, clinicians, it's got adaptive. Everybody got it? In the state of Connecticut. All right. Any questions? I've given you 2 example MAISYs. I have yet to talk about research. Okay, this is the significance portion of your grant. Why MAISYs? Like, why do I even want to do science on MAISYs? I haven't talked about science yet, but you got to explain why MAISYs. Timing could be important. Speed of adoption varies. And when I say speed of adoption varies, at any one of these levels, the speed might be different across all the targets. At the county level, counties are different. At the clinician level, clinicians are different, right? You might want to sequence things strategically. Like, it may not even make sense to do facilitation until you've done coaching. In fact, that was the case in the Michigan example, because a lot of questions were asked, well, Danny, why didn't you start facilitation right out of the gates? Are you guys wondering that? No one asked me. There's no chat questions. Are you guys still awake? So like in that example, we did facilitation only for slow responding schools. I don't know if you remember that from that example. Well, that's all strategic and because of feasibility. We discovered in the design of that MAISY that you cannot even don't bother talking about barriers if they're not even doing it. And they're not doing it unless they have the skills. So that like led us to like, okay, we gotta like buckle down on coaching, which is skills training. Then we focus on potentially other barriers. And that's because everybody's starting at zero pretty much in the state of Michigan, right? So it'll be a totally different setup if you guys are doing implementation in a different setting, right? Okay. And then of course there's health equity. MAISYs are consistent with vertical health equity principles because in a world with limited resources, I'm partialing out these resources in a way that makes sense, right? So remember those little pictures we see people draw? Like equity is not give everybody the same thing. Like flat tax. Equity is different. Equity is going after where there's people or sites and schools are struggling and give them what they need. So MAISYs are consistent with that. Engagement is critical. This is one of the things that gets swept under the rug. It drives me bananas. But I see a lot of people do implementation trials and they say, well, here it is, but nobody engaged. And to which I say, like no one showed up to the training or no one watched my webinar, to which I say, what'd you do about it? And they're like, I didn't do anything about it. And I'm like, wait a minute. If you know somebody's not engaging, go in there and you need an engagement strategy. Well, the moment you do that, you're doing adaptive, right? Because like you did something, you noticed that they're not engaging, and then you brought in an engagement strategy, right? Well, that's a reason to do a MAISY, right? So it's not always about performance. It might be that you're adapting based on lack of engagement. I can't tell you how many times this gets swept under the rug in our field of implementation science. The big one, of course, is more is not better. That's the big dog. We know this so well because you guys are effectiveness scientists. And we know from the past 20 years, we used to think more dose, more duration, more intensity, more strategies, but we know that that's just going to backfire. It's a disaster waiting to happen. All you're going to do actually is the moment you start doing too much, people are going to start dropping like flies. And guess what? Disengaging. Because guess what? You just overwhelm them. You're asking these school principals to do what now? Like, they got a full-time job. Okay. All right. So that's the significance section. I've already hit you over the head. MAISYs are not for researchers. I have yet to talk about research. I've shown you 2 example MAISYs that live in the wild. They're for implementers. So the 2 examples I showed you are for that Department of Education office in the state of Michigan and the state of Connecticut, which employs implementers, which go out to the schools and do implementation. You guys with me? All right. MAISYs are not for researchers. Because they're not for researchers, I have yet to talk about research. I haven't done anything related to research methods. Okay. Other considerations, and then I'm going to move on to the third part of my talk. MAISYs are pre-specified and pre-planned. Of course they are. And this is supposed to be a provocative statement that I'm about to say. You're supposed to disagree with me. All implementation strategies are pre-specified and pre-planned. That's supposed to be provocative. I want you to ask me about that because I believe that firmly. Just like all interventions are pre-specified and pre-planned. God, I'm hoping somebody asks me something. Okay. And then the cool thing about MAISYs is that mechanisms can be tailoring variables. People love that. Those of you that are implementation scientists that love studying mechanisms, you are thrilled if one of the mechanisms you discovered or that you're proposing ends up getting used in a MAISY. You're thrilled, right? Aren't you? Because now it's not just a mechanism. It's not just a thing that explains why something worked. It's actually being used to decide what strategy to offer. And you guys love that. So that's why I have that bullet. Remember, tailoring variables are part of the MAISY. So this definition of startup school here, this definition of, remember, nothing here is research. So this is all, these little monitoring things you're monitoring, they're part of the MAISY. And remember, in this example, they were part of, do you guys remember that engagement and monitoring component that is part of rep. Remember that? The newsletter, keeping them in the game, that whole thing, and sending them like a little questionnaire as part of the newsletter, like, hey, how's it going? How much CBT have you delivered? That's how we found out whether they're startup schools or slow responding schools. That's part of the strategy. That's not research. So that's my third bullet. So now I'm going to ask everyone to put their researcher hats back on, and I'm going to walk you through 13 optimization scientific questions, because now you are a researcher. Okay, so put your researcher's hats back on. So just like we have a Final Four in basketball, here I have what I call the basic but important four. Unlike the Final Four in basketball, these are the first four. And so most of the time, you guys, now I'm thinking you guys are all scientists because you got your scientist hat on. Most of the time, y'all are interested in like, Danny, what's the effectiveness of that coaching intervention? It's really expensive. So that's a question you're asking. Other times you're asking about the effectiveness of something I did later, like, Danny, among all those slow responding schools, what's the effect of facilitation? I really want to know because I'm a scientist. I want to publish a paper that talks about whether that thing is effective, right? And then, of course, you might be a curious scientist and say, Danny, I want to know how coaching and facilitation interact with each other. Like, if I do both of them, do I get 1 + 1 = 5, right? Do I bend the rules of mathematics so I get a positive interaction? Or shoot, Danny, if I do both of them, did this whole thing just backfire on me and 1 + 1 now = 0? Which could happen, right, you guys? Like, if you try to do too much, sometimes you get, bad things happen, right? So that's the third question. And then the fourth question is, like, you guys are always asking me, Danny, do I even have to do anything adaptive? Because, Danny, do I need to do this adaptively? And so, of course, you might have a question about that. Like, maybe you can get away with just doing coaching and that's it. Don't even monitor. Everybody with me? So I call these the basic four. And I did a study. I designed a trial to answer these basic four in the context of something you already know something about. So that example, MAISY, I shared with you earlier, I didn't just pull it from thin air. I pulled it out of this study. So this study actually has 2 MAISYs inside of it and 2 other strategies that are not MAISYs. I'm going to walk through them. All schools that were part of our study were randomized at week 12 to getting coaching versus not. So notice, we did not provide coaching only to startup schools. That was just when I was giving you the example, MAISY. Okay. All schools were randomized because, in fact, one of our questions is, should startup schools be the ones that get coaching? You guys following me here? So because we don't know the answer to that question, all schools got randomized to coaching versus not. And then among the slow responding schools at week 21, only them got randomized to whether or not facilitation. So there is a little bit of tailoring going on there in the sense that we only allow facilitation. We discovered in the design of this trial that facilitation is actually only viable if you're a slow responding school. We know that from prior data and from feasibility data that it absolutely does not make sense. And Michigan shall never provide facilitation to schools that are not slow responding. We decided that ahead of time. So we baked that in here. Everybody with me? That's a decision. That's not a decision that's being asked in this study. That's a decision that is like, that's it. We know that. We know facilitation is only for slow responding schools. All right. Okay. So this was our study, and this is called a SMART because we randomized twice across time. By the way, both randomizations here are at the school level. And these are the results. Let me orient you to the results because they're pretty delicious. Time is on the x-axis. Just think of it as time. Okay. Coach, the end right here, phase where it says phase 1, that's when coaching is added or not added. And here where it says phase 2A, that's when facilitation is added or not added for the sites that are struggling. Okay. All right. So y-axis is our primary outcome, which is how much CBT you're being delivered. And what I didn't show you is that these two curves start at 0. Remember, nobody in the state of Michigan was doing anything evidence-based, let alone CBT, okay? So these curves start at 0. And the metric here is like total CBT delivery per week. You guys feeling me here? So like a 4 means I delivered 4 CBT sessions per week. Got it? All right. And the people we're measuring this on, I don't show them to you here. They're the school professionals. So our primary outcome is a school professional. By the way, that means that this SMART is a clustered SMART because the primary outcome is at the level of the school professional nested within the schools we randomized. Got it? If our primary outcome would have been school level, then it's not a clustered SMART. Okay, now the whopping results. If you see a triangle, let's start with circles. If you see a circle, it's because it's not adaptive. So a blue circle, light blue circle, just means that all I did was rep at the county level. I never did anything else. I never did coaching. I never did facilitation. Of course, we know that some schools will only ever get rep, right? Because some schools don't get coaching and some schools don't get facilitation. That's why I have one group that is just rep only, not adaptive. You guys feeling me? And then I have another group that's not adaptive, which is the green circle, because check it out. All the schools got coaching or not. So suppose you're a school that got coaching, then you're only adaptive if you ended up getting facilitation. That is, if you were slow responding and got facilitation. Otherwise, if you were slow responding and didn't get facilitation, well then, and you didn't get coaching, you know what I mean? Like there's nothing adaptive going on there. You guys following me? So the two circles are the non-adaptive interventions. In fact, the light blue rep is our control intervention because there's no coaching and there's no facilitation. It's like the least intense, least costly of the 4 of them. And of course, the flagship is the last one, the green triangle. That's the Cadillac, right? That means I gave you coaching at week 12. And if you were struggling at week 21, I gave you facilitation. Everybody with me? That's our study design. The most surprising result of all is the fact that blue triangle, which is no coaching, turns out best on average CBT delivery. Now, bear with me, okay? This is not fidelity outcome, which is like the quality of CBT. This is a quantity, right? That was our primary outcome, which there's a good reason why it was a primary outcome because everybody was starting at 0. And what we want to do in the state of Michigan is just get CBT out to these kids. We kind of punted to quality to being like secondary, right? I'm not going to show you today results on the quality. I think we're still writing that paper, although Shauna may have given a talk on it. But this is surprising, you guys. Or maybe not. Maybe you're like, no, Danny, that makes perfect sense. Because there was no coaching and there was no emphasis on quality from the coaching point of view, maybe when the implementation was just designed when coaching is not present, was designed to get them to just do CBT. So maybe Danny actually, maybe this is fact, but I want y'all to know that that's Monday morning quarterbacking. Nobody on the team gave that because we all hypothesized that the best one was going to be green triangle. And we all hypothesized that the least best one was going to be light blue circle. And that is not what happened. In fact, there is no difference between green triangle and light blue circle. Mind-boggling. And in fact, you guys need to know this. That was our primary aim. So like here in this study, this is like what some of you like, I hate this term. I don't use this term. What some of you guys call a failed trial. This is that, even though I can't stand that term. I hate it. This is like a failed trial. Our primary aim, the p-value is like gazillion large because there's no difference. All right. And yet we discovered blue triangle is better than all 3 other ones. And it's definitely better than repless coaching. All right. So let's go to questions 5, 6, and 7. So you might also, as a scientist, you might have questions about tailoring. Number 5, we had one where we were like, hey, I don't know about this cutoff we're using. It might be too stringent, even though we think it's bottom of the barrel. Maybe we need to be even more lenient in how we decide what a responding school is. So believe it or not, this study here, I'm going to be able to figure out whether this cutoff should be a different cutoff. the cutoff for slow responding. In the sense that in one direction, I'm going to be able to figure it out because look, some of the schools didn't get facilitation and some did. So I'm going to be able to like look to see if I should have moved that little cutoff over a little bit. Do you know what I mean? And the schools that are beyond that new cutoff, do they benefit more from facilitation? Like I'm going to be able to check that, you know, in the analysis. So I'm definitely answering type 5 questions. And then there's a bunch of other ones like baseline tailoring, right? Like, yeah, remember that startup school thing? That's just an idea at this point. We are not yet tailoring based on startup school, scale of school. But we are going to check to see if startup school is a good tailoring variable. And if it is, we're going to recommend it, right? But you might have other cool questions about tailoring. Like, let me go back to the study. Like, oh, here's my favorite one, Sapana and Rachel. Here's my favorite one. What if the schools that need facilitation are not just the slow responding schools, they're slow responding and not engaging with coaching? And by the way, that is one of my, like, I can't wait to get to that part of the analysis. That is one of my because I hate that we always sweep engagement under the rug. I obviously want to do science around engagement. So I hope that pans out the way I hope it does, is I'm hoping that what we really learn is that the schools that need facilitation, I hope we learn they're the ones that are not engaging in coaching. But even more interesting than that, y'all, secretly, what I hope is that among the slow responding schools, the ones that need facilitation is based on something the coach learned during coaching. Why do you guys think I want that so bad? I want that so bad because these results might make y'all think, oh, don't do coaching. But what if the reason facilitation is kicking ass here, is kicking butt here, is because the facilitator learned something from the coach. So the coach was present. And remember, like, I want the facilitator and the coach to talk. And so that's how I designed it, right? Like in the background here, the coach and the facilitator, they're in cahoots with each other for sure. Like for sure, they're in cahoots. I designed it that way. I want them to be in cahoots with each other. I want them to compare notes. So wouldn't it be just gorgeous if the coach learned something that they whispered into the ear of the facilitator, and that we discover that, in fact, the slow responding schools for whom whatever it is that something was are the ones that need facilitation? Man, I hope that pans out. But anyway, I'm just trying to get you guys excited about all the things you can do with a study like this. All right, well, then let's wrap this baby up. The last thing I want you to know is where I'm going over the next few years is the thing I'm most excited about, y'all, is, and I need to say it before this talk closes out, is I really want to be able to ask questions that are spillover questions. I want to so bad. Like, and I think we're going to be able to do that here with these kinds of trials because, like, we're going to be able eventually to randomize at multiple levels. So, for example, in the Elizabeth Connors, this is not what she's doing, but it's what I'm using her trial to illustrate. She's not doing this, but I trust me, I tried convincing her to do it, but it didn't work. Like the first randomization might be some strategy that's about the level of penetration of the individual consultation, because that's an important thing the state's going to want to know. So like, is this a county where I need to penetrate with individual consultation in a low intensity way? That is, it becomes a low cost county, or a high cost county where I need to penetrate high, right? This is also consistent with vertical health equity principles and all the rest, right? Counties need to know where to put their resources. So I'm like, dude, let's do a study where we actually randomize districts to that strategy. That is the strategy of how much low versus high resources to this district versus the other one. So eventually we're going to be moving to these studies where we're randomizing at multiple levels. Like this D means I'm randomizing at the district, and this C means I'm randomizing the clinician. And then later, the clinicians get randomized to whether or not they get individual consultation. Do you guys see how delicious this is? And of course, penetration is just one example I'm using here. It could be that you have other district level strategies that you're like, oh, that's going to be an expensive one, and I need to hold that out and learn which districts need it. Well, you might be doing multi-level smarts, randomizing at multiple levels, where your first randomization is to that one component you really want to discover whether a clinic needs it or not. Okay, I'm wrapping up. Just so you know, nothing that I spoke about today has anything to do with evaluation. My entire talk was optimization. This is what evaluation looks like. It's just a 2-arm trial of whatever your favorite optimized MAISY is versus usual care. That is not what I talked about today. I talked about the science that comes before you do evaluation. Thank you very much for putting up with me. I appreciate you guys.
Thank you so much, Danny. This was an excellent talk. You're going to hear from me because I think this is really interesting to think about within a state system. And I do a lot of work in the state system. So excellent talk. Thank you so much. And thank you everyone for being with us today. This is wonderful.